This committee was established by Lieutenant Governor Hosemann in the wake of the Dobbs decision. And it's being chaired by Senator Boyd from Oxford, who, by the way, I think has done an excellent job, has worked really hard on this. And it's to get at issues affecting women and children in the state of Mississippi. And excuse me. And we've heard from a lot of people over the last 2 days, and too many to specifically list out, but service providers, state agency heads, and so that includes people like the state health officer, Dr. Edney. We heard from Medicaid. We heard from CASA, court-appointed special advocate. We heard from Canopy Services. We heard from DHS. So everything that touches on children and women in the state of Mississippi, we heard. And much of it was data that either we had not heard before or it was put in context. And some of it was policy recommendations that had been worked on. But the overall, I guess, takeaway is that based on what we've heard, we're in serious problems. And I will state that first. I mean, from what we heard, we as a state have not done the best job of addressing these issues. And I'm not saying that government is the answer, because it's not in many cases. However, we need the data, which we got, and we need to know the lay of the land from a funding perspective. And then a bigger overarching point of this, and this came out over the last 2 days, is with the Dobbs decision, as was stated by Dr. Edney and others confirmed it, a conservative estimate is that there will be 5,000 births next year coming to Mississippi. And as was presented yesterday, many of those births are in the high risk category because of where things are. And that translates to an extra $1 million a birth. And so we have to look at that in light of the Dobbs decision. How are we going forward, and what can we do to provide the appropriate services for women and children? The majority was, hey, here's the information. We do have 2 hearings scheduled in October to a continuation. Okay. And so that was the main part of it, but there was a few recommendations that came out. One that kept being brought up by different folks, it was the postpartum extension. And what I mean by that is postpartum coverage, which during the pandemic, that on Medicaid, pregnant women who've given birth, they have coverage under Medicaid under that. And the presentations included that should continue to occur. And because what was presented to us from the health perspective is the deaths and the fatalities of women and children occur within the 6 months after birth. If they're getting coverage and getting treatment, preventative treatment, then that gets reduced. Now, that's gotten political. That was political during the session. Health professionals from every person we heard from said recommended it. Okay. Now we can play politics with the life of children and the life of women, or we can help them out. I personally don't take the perspective that it's quote Medicaid, it's Obamacare expansion. Mm-hmm. I know I listen to health people, health professionals. Anyway, so yes, that you're right. And that was one suggestion. And there's different services out there. But from the health perspective, one of the things that was not good was in terms of funding, uh, based on our sister states, according to the data we were presented, we're the lowest there is. And I think it was put in a good way by, I think it was Dr. Edney that said, look, we tackled this in education and we went from the bottom and we moved up drastically because we committed to it. And their point was we need to commit to the women and children just like we did with education, and we can do it. And I think for me that was clear, is that we may do a lot of talking, but we haven't committed to it. And so as far as other recommendations, there were some that came from DHS. There were some that came from let me see, from CPS, Child Protection Services. One of them plus others said one of the problems in the state of Mississippi, and I've known this, is the system that they have to deal with, the court system. So a couple things. So it can be done. We as a state don't have enough policy there. One thing that I have advocated for is what they have on the federal level, which is a tax credit for working parents who pay for childcare. On the federal level, it's already there, and you get a tax credit for the expenses that cost for childcare. I support one on the state level, and actually Attorney General Lynn Fitch and her staff mentioned that today. So I think that's good. She also mentioned other tax credits on that side of the equation. So yes, those things can work. And what is clear is that childcare, how important childcare is. And if people if they don't have childcare, they're not going to work. How we can make those incentives for businesses to do it. Look, we want the private sector and really the nonprofit sector to do a lot of this. So I fall on the side of tax credits and things like that. We cannot stick our head in the sand. I don't think any policy came out today, but it's where we are. But you got inflation, okay, which is under President Biden. You got the rise in gas, and these are all these people, that are affected by it. So it's a reality.